Okay, so now we are live. Hello, everyone, and thank you so much for joining us today for this webinar on how can medical schools become more socially accountable and what is the role of medical students in the process that is conducted in parallel to our IFMSA Global Social Accountability Week. My name is Abdallah Al-Khafaji. I am the IFMSA Liaison Officer for Medical Education Issues. And today I have very special, very distinguished guests with me. So first of all, if you're an IFMSA member, you have definitely, most probably heard of the term social accountability, especially social accountability of medical schools. So today we brought to you someone that is considered the founding father of the term social accountability of medical schools, someone that started this movement in 1995. He was the program coordinator on human resources for health at the World Health Organization, also the founder of the five-star physician concept from Belgium. Joining us today, Dr. Charles Bolin. Thank you so much for joining us, Doctor, and welcome.
Thank you very much. I'm pleased to be there and see you so many on the screen.
And our second and distinguished guest and very, very close friend of IFMSA, very old and close friend of IFMSA that we have worked together along the years, along the previous 5 years on so many projects. And one of the projects that we will be discussing today, stay tuned to know more about it, the Chief Executive Officer of Training for Health Equity Network, also known as the NET. Joining us also from Belgium, Björk Lastote. Welcome. Thank you so much for joining us today.
It's a pleasure to be here. I was impressed with your pronunciation of my name. It's not easy.
I have practiced. Thank you so much. Thank you. So today we will dig deep in the sea of social accountability of medical schools. We will be discussing the major history and milestones of social accountability as a global movement, how it started, how it progressed, and how did we achieve all what we achieved right now. We will talk also about the relation between social accountability and the global health workforce crisis and whether or not it could be a solution for this crisis. Also, we'll talk and discuss the advocacy and promotion efforts worldwide, as well as tips and tricks for medical students and healthcare students on how to take a leadership role on social accountability of their medical and healthcare schools. So first of all, welcome again, Dr. Charles, thank you for joining us. And I would like to ask you, since you started this movement in 1995 and probably before, how this idea started. What was the reason for starting this movement? Who are the major global actors? Who did you collaborate with? And how did we get where we are today? Can you brief us about the major milestones of this global movement? Please have the floor.
Thank you, Abdullah, and again, a good morning, afternoon, everyone. Well, I have to first say that, I have worked for 30 years at the World Health Organization, first at country level, and then on regional level, regional office in Africa, Brazzaville, and then the regional office for Asia in Manila in the Philippines, and finally in Geneva, which is the global headquarters. And I was recruited in Geneva in the position of someone who had responsibility for improving the education of health professionals. All right, so it was a lot about pedagogy and medical education planning and process and of course assessment, everything that has to do with producing the right manpower. Of course, WHO has always been concerned about ensuring that countries had enough health manpower, a variety of health manpower, and well distributed so that people could enjoy the benefits of the medical profession. Very soon, I had grasped that all what we were doing, including in the World Health Organization, was quite in a silo. You see, you had people who were looking after health manpower planning and health manpower production and health manpower management. And so it was all like, you know, a slice, like a salami. And I was wondering whether all that was making an impact as health professional. So I became concerned about working with medical schools, although I work with health professional, nursing school, the school of public health, but I thought that because of the position of the doctor in the health system, for good or other reasons, they are in the middle, in the center. They use the majority of the resources. It takes a lot of resources to train them. And so I think it was worthwhile asking whether all that effort make a difference. So I approached the medical schools, and I had very soon the impression that the medical schools were like this. I show you a picture because I like graphism. I hope you can see that. It's like a solar system, right? With the sun in the middle, and you got all the planets orbiting. And I thought that medical schools, which are just here, one of the planets, very often they thought that they were maybe the sun. And they were not so much considering, the others and the larger context. Now, social accountability is about agreeing on values, right? And the values is the sun. So that's something that is bigger than ourselves, right? And so it was important that when we talk with academic institutions, to say, what are your beliefs? Why you do all this? Or they say, well, we only train doctors. Yes, but where are they going to work? What kind of specialty? Are they working with other health professionals? Are they settling in a capital city? Or are they interested in primary health care? So all those questions, and obviously that was not the concern at medical school. The medical school said, we train doctors, right? So many doctors. And then they do whatever they want to do. They find an employer, they work for the government, they settle as a private practitioner, whatever. That's not our business. And then they say, we do research. And we do research, and that is given to the clinician most of the time. So myself as a dean, I don't interfere with that. Everyone in his department does his research and looks for funding for the research. And then the service mission. Well, the service mission of medical school, well, that's a teaching hospital, right? That's the top of the pyramid. So the best talents and the best services are concentrated in the teaching hospital. So that's where their ideas were. Now we said, but the world is different. The world is different, and it is important that you consider the context in which the medical school live. So again, coming back with my solar system, you have to be about this. And so how do you serve this, right? And so very soon, we, of course, have written a monograph on that you mentioned about, Abdullah. And of course, that had a certain success because it was translated in 7 languages. But still, that is, that's talks, that's paper, right? And you might visit medical school and meet with ministers of health or higher education. They all agree but you don't see very much something coming out of what we said, which is, caring for people, being aware about equity issues, being about effectiveness in a health system. So finally, we try to explain social accountability by this picture. Now, I don't know whether you can see that, right? That is grapes, right? So that's raw material. Now, with that, you can do a lot of things. You can eat them, or you can process them. Now, if you process them, finally, it becomes wine, right? And so here is a barrel, and so you stock your product because it becomes a product. You can sell it, you can drink it, you can share it, but it's a product, right? And so you might be proud of your product. So actually the deans and the professors in medical school say, we are proud of our product. They are the best possible doctors. And they give you indicators about how good they were. All right. But then we said, you got a raw material, you have a product. What is happening with the product? Now, here is a picture of what may happen with the product. I hope you can see that. Right. So what happens with the product? Now, the product has a meaning. In this particular case, there is that liquid that we call wine, which is in a glass, and it's shared in a company. So it has a purpose. And so you start with raw material, and you have an interest how it is processed and how it is utilized. Now, in the majority of medical schools, the interest isn't that, only the product. They do not so much care about the raw material. I mean, the needs of society. Where are we? In which world are we living? How strong are we? How healthy are we? And who is more at risk? And what are the social determinants why people are more exposed than others? All those questions that are upstream of the production, right? There is little attention given to that. What I usually heard is, oh, we need more doctors. Oh, we need more doctors. All right, but what for? And so in social accountability, we want at medical school to think about what is upstream, identifying the causes, the determinants, and the health needs and challenges in society. All right. Now, they could understand that, and we have examples of that in part of the world. But then when they produced their doctors, there was not so much interested to know where they're going to practice, in which specialty they were going to choose. So we said, as social accountability, because it costs so much energy to recruit, to train a medical doctor, that it is worthwhile having an interest of what is happening with them, right? Now, everybody does that in a market. If you manufacture a soda or chocolate, you care about whether people like it. And you have to know your market. And maybe you can even question the market and saying, do you like the taste? Do you like more vanilla or more strawberries in it? See, so it's a common management of an enterprise. but the medical school didn't see that so much. So it is important that there is that system approach, that the medical schools, when they have produced something that they think is good, they should be concerned about what specialty they will choose when they have left basic medical education, where they will settle, how they will practice. Are they going to practice in team? Are they doing some just clinical work? Or have they an interest for a population at large, for a community? How much prevention are they going to do? All those things, the medical school should be involved in that. And when it comes to distribution of the graduates in the territory, for the sake of equity, they have a responsibility. Now they may say, but that's not for us to do. That's the Minister of Health, that's whatever, you know, they may choose to work in the hospital, they may even go abroad and they disappear and we don't see them. And we are saying, no, you share a responsibility in that, because you have to work with the potential utilizer of your product. Eventually the Minister of Health or the private sector, or talk with the professional association and see how the market is growing, so that you have an interest and can influence. Because after all, the medical school is an academic institution with a concentration of talents, intelligence, resources, experience, done a lot of research, and so they are respected in society, so they are able to advise on what kind of health system the country needs. They should not just, stay indifferent on that. They should be involved. They should make recommendation. They should take risk. All right. So social accountability became spread around the world, and increasing attention is being paid to social accountability even today. When I look backwards, like 25 years ago, and I look at a map of the world with spots of where social accountability was understood, welcome, applied, very few lights on the map. But today, they are full of lights. I do not attend any medical education conference in the world where there is not that question being asked in one way or another. And so, in a way, that's gratifying, because people talked about it. There is publicity about that. But obviously, it's not enough. Although, we have even a country, a whole country, Canada, which I would say 20 years ago, as a country, the entire medical schools, there were 14 at that time, now there are 17. So the Association of Medical Schools in Canada and the government, the Ministry of Health, the federal, meaning covering the whole country, they issued a paper saying, this is the way to go. If we want to serve our people better, medical schools ought to be socially accountable. So here we have a whole country, not just an individual in Iraq or Bangladesh or the Philippines saying, oh, that's great. No. And not just a medical school here and there. No, it's a whole country. So that's an achievement. Now we have even organizations that are almost 40 years old, maybe a little bit more. And I know them from the beginning. which is the Association of Medical Education Europe, AMI. It's a big organization. They meet every year, and every year they have about 3,000 participants. Of course, I'm not holding meeting nowadays for the reasons we know, but a lot of people. And usually it's more than 80, 85 countries being represented. And I know the founder of that organization, my friend Harden, and I like what they do, but they were very process oriented, meaning how to teach and what to teach, how to train medical educators, how to assess, all that technical aspect. And so, like 10 years ago, I said, listen, that's wonderful what you do, but what for? What is the purpose of all that? Is that going to make a difference on people's life, on society's health status? And why don't you be involved in, and I say, social accountability? So luckily, they then set up what they call an Aspire to Excellence, which is giving an award to a medical school that performs well in several areas, including in social accountability. So wonderful. Applause. Very nice. Of course, then we have the Network Towards Unity for Health, which I was involved in it from the very beginning. And they have always been very close to that idea. So here we have another group that is extremely motivated with pioneering schools all over the world. And they know what social accountability means, and they apply it. So that's great. So after a quarter of a century, we may say that the concept is being spread, not necessarily well understood, because those three aspects I mentioned, the raw material, the product, and the outcome, as I say, it's very process oriented, not enough about what is upstream and what is downstream. But anyway, things are moving. So the challenge today is for the leadership, because I think we will talk about that. The leadership, the deans of the medical schools, to be more proactive. It's not enough for them to say it's great, it's wonderful. They have to set up, I think, a think tank in their medical school, a sort of unit. And in Canada, for instance, they have vice deans on social accountability, meaning that social accountability is not just a discipline, anatomy, physiology, or what have you. No, it's a vision. It's part of the strategy. So that unit of social accountability medical school is close to the dean's office, and it has an influence in should have an influence in all the specialties. So that's one challenge. I think we should say clearly to the deans, now you heard that this is important, worthwhile, why don't you do something in your own organization? And very often when we talk to the deans, they're saying, but we are doing that since ever. And actually, what they're saying, we have community-based education. We are sending our students in the field, and they're doing some primary health care, and they're doing some survey here and there. All right, that's not bad, but that's level number one. That's very the basic. And that doesn't change necessarily the mind of people. But it's all right. It's already the beginning of something. Now, what we mean to say is that we want a medical school that has a contract with the territory in which, so many thousand people are living in. And with the main stakeholders in that territory, in that space, they should have a contract. Uh, I would say even a written contract where you got the obligation of different partners well spelled out. And the contract is about addressing a priority health issue in that territory. So that the medical school, if they are engaged in that relationship with the health actors, they will soon realize what is missing in the education, what is missing in the research, and what is missing in the tertiary care service that they are doing. Because they're seeing what is happening in a large territory like a province, right? So that's where we want the deans to move. But that might be not enough, because you see, you may have a good medical school with a leadership dean, and then if that person takes, leaves because for retirement, all the nice initiative may collapse. So there is no institutionalization of social accountability, right? There is no strategic direction clearly written out for everyone in the school to follow. And that's one of our problems, because it is mainly based on goodwill, on a wonderful commitment, but there are no fixed rules. And that's why we believe that at the national level, something must happen, because all the school should be encouraged by the higher authorities in the country, eventually the Ministry of Higher Education and Research, right? Or the Ministry of Health in some time. Like in Iran, for instance, in Iran, the medical schools are under the Ministry of Health and Medical Education, because they have no Ministry of Higher Education. It's all mixed, right? Okay, but at the highest level in the country, there should be clear recommendation, encouragement, and physical support, material support. And eventually, there should be an accreditation system that medical schools have to take on a compulsory basis, right? Or they may or may not take it, but they don't take it, they may be then asked to close their institution. So that's the ultimate stage where we will, at a global level, have a consensus to have an accreditation in every country, and that accreditation is socially accountable, meaning that all the standards to assess the quality, the excellence of medical school, they have to be colored by the principle of social accountability. Is that a dream? Well, it's a dream, but it's an ambition, and there are enough people in the world to think that this is the way to go. And so I'm very pleased to say that with our Canadian friends, we will organize in March a global conference, virtual, with individuals from different parts of the world that have an influence on the regulation of medical education, to come and assist and agree that it is time for accreditation to be respecting, promoting the principle of social accountability. So here we are. I think we are optimistic, but we are vigilant, because unless it is not written on a rock, it may eventually disappear. So here we are. Thank you, Abdullah, for a moment.
Thank you so much, Dr. Charles. You took us through a very inspiring journey throughout the past quarter century. I was personally very inspired by how you beautifully demonstrated the journey through your very artistic drawings. And I agree, to have this vision. It's a dream, but in my very humble opinion, dreams do come true. And hopefully, as medical students, as you can see, we are looking forward to contribute. We look forward to achieve that dream. And absolutely, with your help and your guidance and your support, at some point in the future, we will achieve this dream. Thank you so much, Dr. Pauline. And now I would like to go to my other guest. Miss Bas Daughter, you have just briefed me a little bit about your journey. You have traveled around the world. You have worked in global health in multiple capacities, and you have an experience around the global health crisis. I would like to know from your perspective and from capacity as working for the net and also working on social accountability, what is the linkage that you can show us between those two very overlapping domains, social accountability and the global health workforce? Can social accountability be a solution for the global health workforce? As Dr. Bolin just said to us, people always in health systems around the world always complain, we need more doctors, we need more doctors. So I am curious, and I'm sure everyone else is curious to know about your perspective. Please, you have the floor.
Thank you for having me. It's always exciting to be with this crowd. I know that this is where the change will come from. You guys are the ones that are going to lead us even further. Well, my journey started a little bit earlier, but sort of the journey onto that, the social accountability actually started with understanding that there was a health workforce crisis, and meaning there was both a shortage of health professionals in general, there was a maldistribution. Most of them were in bigger cities or working in richer communities, et cetera, rather than rural areas or poor communities. And there was a misalignment, not only between actually what students were learning and what the kind of competencies they needed on the ground. And like Shah was saying, because people weren't looking at what happens when the product comes out on the market, people weren't even sure. And a lot of health professional schools were just, their goal was to produce X number of medical students. So our journey started with looking at, well, what are medical schools doing to try to address this health workforce crisis? So at the point, we weren't particularly looking at what it was then the term social accountability. We were just really looking at, is somebody addressing it, and how well are they, successful in doing that? So that led us on a journey around the world, and where we identified schools of medicine that were either designed to address, all of them were based in one way or another in some sort of underserved area. Some of them were specifically created to address that. This is both in high and low income countries. So we found schools in Canada, Northern Ontario, Canada, in Australia, in Nepal, in the Philippines, Sudan, South Africa, all over the world. So what we found is that there were these schools that seemed to be having a success and that had that as a focus. So what we wanted to do initially was to sort of learn from them. And what was fascinating to us was that we identified whether you were working in a high income country or a sort of socialized healthcare system or a private oriented or very, very weak health system, there were some principles that came out. So we brought these, it wasn't sort of a comprehensive study of all the schools, but we looked at particularly innovators that either had demonstrated success or specifically set out with that as a goal. And what we discovered was that they shared some principles. And I'm going to just share my screen here just so that you don't have to look at my face the whole time here. So let me just, can I share my screen? Oh, okay, let me just see if that works.
Yes, you can.
Yeah. So let's see. And again, and it sort of got to the definition in terms of, we talk about social accountability, and actually, maybe when I finish, I would love to hear people's perspective, because like Charles said, we've also felt, depending on who you speak to, people have a different interpretation of what it is. I've had conversations with people who say, yes, no, social accountability is good, but we also need quality. Not understanding that quality is just as an important part as equity is. Anyway, so what I think is important, what these schools were doing differently, and again, they were doing, like Sean was talking about, they were looking at the broader context. And they started what are the needs? Who are we addressing? Who are we working for? And very often that is the biggest challenge for schools that are starting out on that journey, because they haven't necessarily defined who they are serving. They want to produce doctors for the world, international excellence. They haven't said, we're based here, and this is our area. One of our member schools in Mindanao, their mission statement is to meet the health needs of Western Mindanao. And then when you know whose needs you're meeting, that's when you can actually start assessing them. And then, it also requires, you have to operate in a system that sometimes enables you, or sometimes it is a challenge. And it's defined, again, like Charles was talking about, accreditation is an important element. However, when we started this, all of the schools that we identified, none of them were operating in systems where there were necessarily massive amount of support per se, and certainly not in accreditation, but they were driven by leaders that had that commitment. So our group, which is the Training for Health Equity Network, is actually a community of practice of schools of both medicine and other health professions that are, I would say, striving towards social accountability, because I think there's a danger if you think you've arrived, you probably stop checking. So we started by developing a framework to really look at, what are the difference that we're making? What exactly is it that needs to change? And again, Charles talked about it, and Charles was a part of our initial founding meeting, is what do we need to do? And not only in terms of the curriculum, but who are the students who we recruit? Are they the students that are most likely to be willing and ready to serve in the most marginalized areas? Do we support students to get through this? Is the learning actually in the context where they need to be working or where they're most needed? So all of that, and who is making decision? Is it just a bunch of academics sitting at the dean's level that have not spent a lot of time in working in a poor community or in a rural setting? Or are there partners that are part of that decision making? Are we really working with the community to understand what the needs are? And then finally, how are we making sure that we're actually meeting those needs? So again, so this is, social accountability is about change at a lot of levels. It's both at systems level, which is the enabling environment, but also at institutions. And I think that's really important, because we also know that the culture of an institution, if the faculty that are getting just grants or doing research are the only ones that get promoted, but the people that are working, teaching students in the community or leading community efforts, they don't get promoted. They might be on the newsletter, but they don't actually get the promotion. That sends a message also throughout the institution. How do you allocate your resources? Are you putting it into community clinic, or are you actually training medical students mostly in the teaching hospital, like Charles was talking about? And the fact is, especially today in large teaching hospitals in urban settings, you see a very small sliver of the spectrum of health. because people usually come to a hospital when they're very sick. You don't see so much what made them sick or what happens before, whether it's the social determinants or whether it's, the kind of behavior, that takes place, or, the food you have access to, et cetera, et cetera. So that was all of these schools were then looking at the context. And then it's about individual and cultural change. What do we value? What is considered excellent? What is an excellent institution? Some years ago, Dr. Fitzhugh Mullen did a survey in the United States, and he looked at the social mission of medical school and used that as a measure for the schools in the United States. And without mentioning any names, but some of the fanciest, most famous schools actually didn't do so well when you looked at where their graduates were working, whether they were actually doing the kinds of things that were most needed. And I think certainly COVID-19 is demonstrating the importance of primary care, the importance of working with communities and being connected and knowing what communities need. So I think we have a massive failure in that sense, but we've also seen, certainly from the schools that are a part of our network, is the ones that had strong relations with communities. They could go out and figure out how can we help, because they had that trust built over time. So, so let me just say, as I say, I think one of the things that is really important to understand, and I'm going to stop sharing the screen here, is we need to, we're talking about real change. And I think we have an opportunity with this particular crisis to say and ask ourselves, and I'm sure, actually, I think I found in my interaction with young folks that are in the health professions, they've often got their fingers on the pulse, often more than their faculty. They are much more connected often to where the problems are. They have often a broader understanding of the social determinants of health. And they're asking the right questions. So, one of the things, just to briefly go over what we found, what was in place for all the schools that we identified, was the fact that they actually started with the needs in mind, and then they designed the curricula. And that meant you would obviously incorporate basic clinical and the social sciences, because we all know, that nobody would be smoking, because most people know that it's not good for you. So behavioral sciences are important. If you're going to mobilize a community to actually start eating better or exercising, that is not something usually you're taught in a medical school. Or if you have to go advocate for your patients, or advocate for, maybe it's transportation that women need to be able to deliver in a clinic. So it makes, and I think there's a really good question here that we need to also be asking is, so what are the basic sciences? Maybe public health should be much, more integrated into the work. So what we found at all our schools is actually they threw their students into communities almost from day one. So what they would be doing, they might be doing sort of a public health assessment to understand what the needs were, but they learned to understand the living conditions. Whether the institution was based in a rural area or in a smaller or in an urban area, they actually would spend weeks and weeks in communities understanding the condition that people lived in. And then one thing which was also very clear is, because they started with the needs in mind, they asked themselves the questions: are the students that we're recruiting the ones that are most, for example, in Australia, willing to work in Indigenous communities, or in Canada, or same thing in the States? Are And that actually brings some other questions. So are your grades in chemistry or this top grade in sort of the basic sciences, is that an indication of whether you will be a good doctor? And that actually has been shown is not an indicator of whether you'll be a good doctor. So they've all adapted slightly different ways based on their condition. A lot of them then tended to recruit from underserved and or underrepresented communities, and or they try to actually make the entry exams, or if they had exams or entry admission, they will weigh if you are coming from a background, that is underserved, etc. So, and then another thing was their learning methodology were focusing on the student and the learner, and all of them incorporated service learning and team-based learning and communication in terms of advocacy, working with communities, understanding culture, not only everybody else's, but understanding what your cultural bias might be making you miss. What is it that you don't see? I mean, and we're doing a really interesting study now on the social determinants of health. And one of the areas that we've found out is the fact that social determinants not only affect equity, but also the quality of care. If you are an African American coming into a clinic in the United States, you are less likely to get the same care that somebody who's white. So there's a lot of issues that we're talking about. That's why it is institutional change, it's cultural change. And I think sort of this year, 2020, has brought that to the fore. And that's why we definitely need not only medical schools to stop and ask the question, how do we need to act and be and make decisions and work and measure progress and success, but we need students to take a lead and to ask those hard questions and to start exploring how we move forward. So questions, if you haven't all fallen asleep yet, thoughts, question, challenge us here.
Yeah, of course, we will have adequate time for questions and answers. And I really, really encourage everyone attending us through Zoom to ask as many questions as you are, because this is a once in a lifetime opportunity. I would say we have two legends of social accountability, so you better prepare very good questions at the end. And yeah, I would like to thank you, Björk, for those very insightful information about what are medical schools offering their students, and how important is the relation between students and community, the role of cultural biases and the social determinants of health. But maybe I can go back to Dr. Bolin. Perhaps he would like to follow up on this same issue. Can social accountability of medical schools mitigate or help resolve the global health workforce crisis?
Well, excellent question, because the document that you referred about, written 25 years ago, the WHO monograph, the title was Defining and Measuring the Social Accountability of Medical Schools, not of medical education programs. No, because we thought that the academic institution is a key partner in the health system. There are other partners, probably more important to have an impact on people's health. You got political leadership, you got the health authorities, you have professional associations, you have insurance companies, you have all kind of society association dealing with health. So the medical school is not necessarily the main agency, but we want to say that a medical school that is social accountability in relation to the question you asked, Abdullah, is it helping out the health manpower, the health workforce crisis? Well, the medical school has to ask that question: what is the ideal doctor for my country? Is it a person that is an excellent clinician? Is it a person that is excellent in communication, advising people how to change lifestyles, not just in my office, but eventually also talking to schools, to enterprises, in the public? Or is the ideal doctor eventually a team leader? He can work with others. He can delegate one of his tasks to other health professionals, because I hear very often medical deans, including ministers of health, saying we need more doctors. I'm not sure we need more doctors. No, we need more health professionals of a different kind. And some of the tasks that the doctors do today can be delegated, given to others. We see that certainly with COVID, right? But so that is the question that the head of a manufacturing company is asking: what kind of product am I going to put on the market, right? So they have to ask that question. And again, if I was a student and I enter a medical school, the first day, knowing that I may stay in that school for 5, 6, 7 years, I would ask, what is it that you are going to be prepared to? I want to know what are the competences that I will have when I get out of this institution, because that's the contract, right? And so I will find out whether my medical school has an idea about what the ideal doctors should be. Now, the ideal doctor is certainly different of what we see today. Because if primary healthcare is this foundation of any successful health system in the world, which have been demonstrated in some countries by some researchers, if that is the foundation, if it is a priority, we should then train individuals that can work on that level, and not just a doctor, but several health professionals. So I like institutions that are called Faculty of Health Sciences, where they train doctors and nurses and pharmacists and dentists in the same building. Of course, they have specific courses, but they share common resources, right? Common courses, right? Common professors, all right? And on the field, they work together as a team so that once they are graduated, they can work as a team. But I like to say this, that in spite of all what we do in the educational domain, suppose you had the best possible curriculum, the best possible teachers, the best possible, educational resources, etc., etc. And we come out with a product that is absolutely wonderful. Well, that will not guarantee that we will solve the health manpower crisis, because a good product might be badly used. Now, if you train me to be a wonderful team member that I can delegate to other health professionals, etc., but if I'm working in an environment where there is no team, there is nothing to delegate, I'm just in an office and waiting for my 40 patients to look after in the waiting room. If that's, see, the working condition, the future working condition are sometimes more important or as important than the education aspect. So I don't think we can transform them. We may transform the mind of a person, but if the market is not consistent with the principles and the competence I have acquired, it's work that has vanished. So that's why we are saying that a medical school that is socially accountable needs to be absolutely integrated in the health system and taking a responsibility for providing best possible health care to so many individuals in a territory. So we're not waiting for people to come to see us in the office or in the hospital or the emergency room. And we're not just waiting, we are going to look for them and understand what may change, what may need to be changed in that particular territory. Of course, you may say, but working in a territory, that is the job of the Minister of Health, isn't it? Yes, but the talent of the academic institution is to provide arguments, tools, methods to improve the quality of care, to improve the equity, and to improve the efficiency. Because, there is one thing that we know, that the resources allocated to health today in any country of the world are too short. They're too short. And the more we go, the people will grow older. So they may be affected by more chronic diseases. And they will then ask for therapeutic intervention that are very costly. So the more we go, the more there will be demands for more service, while the resources are likely to remain the same. So there is a need to rethink the health system. And so that is part of my response to your question, Abdullah. Can a medical school that is socially accountable contribute to address the health manpower, health workforce crisis? Yes, if it is involved in understanding and improving the health system. So they have to get out of the campus. And you see, it's not new, because I know 40 years ago, WHO has had a resolution passed saying that there needs to be a coordination between the academic institution and the health system, so that you produce what is needed, right? In numbers, in quality, in the way of working. And so WHO has promoted those principles of coordination among those education and health system sectors. And the countries have said, yes, it's a good idea. But nothing has really changed, I must say, except one country, and I mentioned that, in Iran. They said there is one way to make that coordination, is to create only one ministry, where they control the production of education and they also control the deployment. So that the dean in a certain area was himself the director of the local health system. All right. So we may talk about all that in detail in another time. But that is an example. Is it successful? Well, needs to be seen, because there are other issues. But so a medical school that is socially accountable is part of the health system. And they would say, I want to be partly responsible of the way we deliver healthcare. So that's my quick answer. But see, very often I was asked this question. It is not easy to assess whether a medical school is socially accountable? What are the indicators? And of course, we work on that, certainly. And George know that in the net, they have also designed such sets of indicators. But if there was only one question that I would allow to ask to a medical school to give me an idea of whether they are on the right path or the wrong path. One question. I would say to the dean or to the leadership, has the school a written arrangement with the key stakeholders in the health system in a given territory by which you commonly agree to share your resources to address a priority issue commonly agreed on? Now, if they have that, I would say now, if I can see that and eventually control it in practice, they're giving me a wonderful sign that the intelligence of the university is being put at the service of society.
Just wanted to quickly add to that, actually, because the net has been looking at impact, and we actually have been able to demonstrate impact. So it depends on, the most clear impact is with our 2 schools in the Philippines, whereas other schools in the Philippines, about 68% of graduates often actually go abroad. The 2 schools that have very strong social accountability principles, 80% of them are working in underserved communities. 90% of them remained in country. We then did a follow-up study looking at the impact, and we took maternal child health as a proxy. And what we were able to compare is communities served by these graduates, and then in the same region, comparable communities versus communities served by sort of more conventional schools. And it was fascinating to see that women were more likely to deliver in a health center if they were served by somebody, a health professional that understood the context, a socially accountable, if you will. They were more likely to have all their children vaccinated. They were able to, more likely, statistically significant difference in terms of showing up with actually the certificate of vaccinations. And there were sort of several other indicators. But they also were able to show that their graduates, like for example, one of the schools, 60% of the district in their area had no health professional beyond I think, midwife. So after 15 years now, basically I was just speaking to Dr. Crispa, who Charles knows, they have graduates running their hospital systems. They have graduates now covering most of the region. So it can be done, but it's also because, like Charles was talking about, because they work incredibly closely with the health department, with private sector, et cetera, et cetera. So they can have an impact. Obviously, it is much, it's a hard thing to do, and it's easier to measure when there's very limited service, but it definitely has an impact.
You see, just a little anecdote from a country that I have always considered to be very conservative in that domain, which is the country in which I live for the moment, which is France. Although it's not my nationality, but I live close to Geneva because Geneva was my office in WHO, but physically in France, which I know. And there are 40 medical schools in France. I believe there are good schools, but they're far to be socially accountable. But there is one that I like to cite. It's in a city where you got the wonderful castle of Château de la Loire. It's the city of Tours. And it is the only medical school in that large territory. The dean of the medical school, he is a pneumologist, right? So he's a specialist. He's good in his field, but he has understood all those issues. So 5 years ago, he told me, I'm going to do this. Please help me. I will invite in the medical school, at my expense, all the key stakeholders in the health system in this territory. The representative of the Ministry of Health, patient association, nurses association, mayors, local political leaders. And I will invite them in my medical school for 1 day, and I'm feed them. And I will ask them one question: what can we do for you? Imagine that. What can we do for you? And so he got a whole series of responses. And the one that came on top was, can you help us to have medical doctors settling in an area that is far from a medical service of any kind? Have you any influence to help us to better distribute your graduates? And so not only made he that invitation and commitment, but they got every year a follow-up meeting to see what are improvements. Now that shows you, that is, now that chap is now completely locked in that thinking, right? Because he made that relationship. And of course, as a result, many things are changing in the education and even in the research, because it is a relationship. It's a wedding between an academic institution and a region. You see what I mean?
Yes, absolutely. Thank you so much, both Dr. Bolin and Ms. Vastotter. I'm personally very inspired by the statement that Dr. Bolin stated, that we don't necessarily need more doctors, which is something very bold to say. This is a whole new perspective that you are bringing to the floor, and we could perhaps replace that with the potential increase of other health workers with certain increased capacities, and the possibility of the doctors and physicians to delegate tasks to the other members of the health workforce. I think that's a very new perspective that is worth exploring. And yes, thank you both as well for all of the examples that you have mentioned from around the world and the indicators for socially accountable medical schools. Now, I would like to shift the conversation towards the main theme of our webinar, which is how can medical schools be more socially accountable? So that is the main question. And I would like to specifically dig into the influence of medical students in that process. What roles can medical students play in that process to get their own medical schools more socially accountable, and to be equal partners in that process, not to be tokenized, not to be used by per se adults or faculty members, but to contribute equally as a main stakeholder in that process. So first, I would like to ask Björg about your perspective on this, especially from an advocacy based approach. As you work as CEO of the Net, you have been, correct me if I'm wrong, working on social accountability for more than 5 years. What examples did you have through your work, and especially in collaboration with medical students? Please have the floor.
Sure. So we have been doing this for quite a while, and there are some successes on paper. Initially, As you may know, the World Health Organization global strategy on health workforce, human resources for health, actually calls for social accountability in accreditation as being, an important part. And we certainly advocated for that in partnership with IFMSA. We also worked with, we were commissioned to write a sort of a policy brief on the contribution of health workforce education or socially accountable health workforce education to achieving universal health coverage. So again, that being mentioned and brought in was certainly important. And again, we've had great partnership with IFMSA, which is definitely around the table at WHO. We've also, as you most of you know, I'm sure, develop a joint toolkit. And that was certainly an initiative which started actually at a discussion with Stenche, who was a president, 4 or 5 years ago, whenever we started that conversation. It was the question, well, what can medical education students, what can medical students do? And we had conversations about potentially having medical students sort of giving schools a grading, sort of how well they were doing, trying to sort of hold up the mirror against their own schools. And in some cases that has worked, because I know there are great efforts. IFMSA had great success in influencing, for example, in terms of drug policies and junkets, et cetera. And so that was one idea. Now, the challenge is, of course, also, it's often hard to be a prophet in your own institution. And there's a cultural issue. It's easier in some and not in others. But for example, most of the schools that we work with, students are a part of the decision-making process. They are, I know, for example, in the school here in Ghent in Belgium, students were involved in reviewing the curriculum. So that is one element where you brought in. When we apply the evaluation framework that we created, students are a part of that feedback loop. So that was part of the thinking behind creating that advocacy toolkit. We certainly help with in terms of asking those questions. So you can. There's a lot of things to do, but I think the first thing I think is get educated about social accountability. Try to understand what that looks like, because in some countries where we first started advocating for it, which was in the United States, the word social, it's gotten better now, but it was, people would scream communism, oh my God, this is terrible. So we, at some point, I remember we were being asked of not using that people would kind of shut down when they hear the word social. In other places, accountability got people thinking about being counted. So, the wording matters, how you frame things. So if in your culture, at your school, you think these kinds of words make stop people from listening to you just because they hear that, you want to think about just what are the strategies. And that's been in certain countries where, including in the States, there are standards that would be associated with accreditation standard associated with social accountability, but they're not called that because that is not helpful in that process. They might not be likely to be approved. But these are the exact same issues. So think about, really try to get, educated around that, and then start to try to understand, well, what are the challenges in my community? You look around yourself, does, the student body, does that look like the country? Is it, in most countries, folks that are in medical school tend to come from the upper echelons socially. They tend to be of the dominant, whether it's ethnicity or race. What is your school doing about that? Just to really understand first the context of your school, and then start asking questions. Obviously, I think it's important to find allies, both among faculty and other students, and then try to get a seat at the table. You know, whether it's in curriculum discussions or create events where you invite the dean, you know, bring ways of engaging in, I would say, importantly, in a non-threatening manner. I think sometimes the challenge for us that care really very much about something, unless you're lucky enough and, you know, to have leadership that is really open to social accountability, you know, it is important, you know, not to get folks on the defensive, and start from sort of the positive asset approach. What are we doing right? And then, you know, what else could we improve? And then even just ask the question, are you tracking your graduates? The net is tracking currently 6,000 graduates in 6 different countries, because they started by looking, because we want to understand first, what career goals do people have when they get into the school? And then what happens during that time? Does that influence, does that change? And then 10 years down the line, where do they end up? And that includes both, you know, whether their specialty, where they're operating geographically, which population do they work, the type of work, what kind of programs have they set up, et cetera, et cetera. All to understand, are we having an impact? Because the world changes. You know, it's not a static thing. It's something that we institutions need to have mechanism to measure success. And if it's only about, you know, how many publications you've had in peer-reviewed journals, but not have these articles actually, or our research impacted policies or practice in our country, you know, then maybe that is what you want to advocate for. You know, participate in studies when maybe some of the faculty are doing research on your opinion. You know, let them be known, and help schools hold up the mirror, and you know, call for accountability. Work with the communities are your allies, but very often they've never been a part of the community. They don't even know that that's a part of the role. So have community dialogues, get your own input. You know, there's tons, and I know you have many more ideas yourselves, but really start with getting educated, and then think, what works in my context? What can I do? And document it, write about it, share it with your peers. And there's lots of folks all over the world that are doing great stuff, and there are resources available. They're both, you know, at the net, but the Network Towards Unity for Health, and Francophone, there's Refresh. So there are folks doing this, so you don't have to reinvent the wheel. But you know, there's lots of stuff to do.
That was amazing. Thank you so much, Björk, for those very insightful information. Thank you. And I would here go to Dr. Bolin with the same question. Dr. Bolin, as you said, you have been working for a quarter century on social accountability. You have met, interacted, worked with medical students who are passionate about working on social accountability towards making their schools more socially accountable. Can you brief us about examples from your previous interactions, and what would be your advice to medical students who are looking forward to achieve social accountability for their medical schools? Please have the floor.
You know, the change can happen in very different ways. Sometimes, you know, you've got good luck. Just a little example. 10 years ago, I was attending a meeting of Francophone deans. So, you know, there are about 150 medical schools in 35 French-speaking countries. All right, and they meet regularly. So at that meeting, I had attended, and made a speech about social accountability. At the lunchtime, we were all gathered in a bus to go to a restaurant. I sat in the bus. Next to me came a young gentleman sitting, and of course we introduced ourselves. And he was the dean of the medical school from Tunis in Tunisia. He was about 40 years old, young, dynamic, and having spent myself 6 years in Tunisia leading a WHO project, I didn't know that gentleman, and he didn't know me by looking at me, but he knew my name. So we introduced ourselves. Say, "Oh, you are Charles Bond. All right. And so, what are you doing?" And I was telling him, and he said, and it reminded me that later on, that at that conversation, and because of the meeting in which he was in, he decided that his life would be different, that he would devote his life to social accountability. His profession was pediatrician and, of course, dean. And he has transformed his school tremendously. And it is really his culture, as we say, it became his culture. But that's, I would say, something exceptional. Now, that dean of Tunis Medical School is so good that he was recruited by the University of Montreal in Canada. And now he is the head of the unit of social accountability at the University of Montreal Medical School. So this is, let's say, good luck. But now, more down to earth. If I was a medical student, and I'm convinced by the fact that social accountability is the future to go, I would, as George said, I would, educate myself. I would read. I would have, some arguments on how to defend that particular point of view. And I would see whether there are some companions that would share the same ideas. So make a little group among yourself. And number two, at a certain moment, I'm sure that you will identify a staff member, someone who is a little bit older than yourself, that is close to that idea. He has not heard the term, or he heard it, but he has mixed understanding. But you being more educated than probably him, because you went through literature, etc., you may convince him to work with him and eventually make an inventory of what is happening in your particular school. Because it's always good to start from a positive point of view. Because we are sure that in any medical school, there are some events, some activity that are socially accountability compatible. They're close to the idea, that are on the way of becoming socially accountable. So if you make an inventory, for instance, in a school with a little survey and saying, at least this school, which I think is conservative, but still does a number of things that are not bad. And so you have that sort of inventory. And I would say that at the end of the year, or at a certain moment, you convince your staff member, eventually the dean, to hold a symposium. It's all organized by students, plus some staff members who progressively had added on. And you organize a symposium just to, report on what you have seen, what you have heard, eventually inviting a guest that could, consolidate what you're saying, and eventually also indicating that things are happening abroad. Now, that little symposium should have an effect, I'm sure. And hopefully the dean might take a decision. They might take a decision that we will eventually think about a plan of action. What is it that we should then improve? Because we made an inventory. At the same time, so we had to identify the gaps. And so maybe the dean, who is a nice person and certainly honest, he wants to see whether we can fill the gaps. And so you got to create a momentum. But I think it's very important to be linked with another organization. I mean, if you could twin with another medical school that has made a little bit advancement so that you don't feel alone. You feel supported by others. That is also, so the twinning is something that should be considered as well. And so progressively, I'm sure there will be some, focus around that issue in your medical school. And as things are moving all around, worthwhile in that direction, unless the dean is completely blind and deaf, he will say, I want to be part of that. And you will be the initiators, which is wonderful. I'd like to say this. Most of the medical students of first year that I'm seeing are very charismatic. They have the sense of values. They want to be active in changing the society. They are not necessarily to say, I want to be a doctor and earn money and have a Mercedes next year. No, that's their mindset when they enter in the institution. But it didn't last long, because as soon as they get in their studies, they come in contact with machines, technology, specialty, and progressively that whole dedication for the nice cause is sort of vanishing, and the rest is coming up and perverting them for being what they initially wanted to be. So I believe that medical student is an absolute great potential for change. And in the day of today, and I see that the way you are organized and can master communication tools and technology, today you are absolutely indispensable for making things happen.
Thank you so much, Dr. Boy, and thank you for all the advice and for all the tips that you have presented to medical students. I'm sure some of our audience here on Zoom or YouTube will take a lot of those messages back home and hopefully will work on implementing them. So before we move on to the questions, I would like to use the moment to basically promote some of the work that IFMSA did in the field of social accountability. One massive achievement that we have collaborated on with our dear friends in the net, with Björk and her team. So basically, this is, I hope you can see my screen, this is the Students' Toolkit on Social Accountability in Medical Schools. This very powerful advocacy tool was developed 5 years ago or 4 years ago by those two main organizations, IFMSA and the net. So where can I find this tool? Basically, all you have to do is go to ifmsa.org, social accountability. I will open the website for you. You can see it. And it's not only the toolkit. I will show you, this is the website. You can read a small description here. There is a video of 5 minutes that will basically give you a short overview of the whole concept of social accountability. You can download the full toolkit that is not only provided in English, but also in 3 other languages. It is very efficiently translated into French, Spanish, and Arabic. For example, if we can go through it right now, you can see that it's composed of so many domains. It gives you the whole concept of social accountability, the benefits. It has an assessment tool in order for you to be able to assess your medical school, whether it is social accountable or not. And it also gives you some powerful references for you to educate yourself even further, to use it to advocate for change within your medical school, within your country, national member organization of IFMSA, if you are a member, as well as with your local committee and your local context. In addition to that, as you can see here in the website, we have this assessment form that you can also download, and you can use it as a tool to assess social accountability in your school according to those indicators that were developed in partnership between IFMSA and the NET. You can also, for example, give a training to your members. If you are a member of an IFMSA national member organization, you want to raise awareness and build capacities of your national or local members, you can give a training. For example, if you go here, you'll find a full trainer's handout that you can use that has literally everything you need, including the PowerPoint presentation, a description of what should you do as a facilitator. It contains what should you do in every minute of the presentation. It gives you all the resources that you need to develop the best possible presentation or training session for your members. Else, I'm here to lobby with your medical school, which is basically a letter that was developed by medical students. Let's say that you had issues trying to fully comprehend the very wide and sometimes complicated concept of social accountability, because it's not easy for a medical student to learn something on a very high institutional level like that. We have also developed a quartet game, which is basically a cards game, as I will try to show you here. You can see that it's composed of this is the quartet game. It is composed of cards. Here are the instructions. And it has different colors that you can use to challenge your, let's say, friends, members, other students from your medical school. It is very, very useful for you to learn about things, about social accountability in a very fun way and a very enjoyable way. And yeah, from my personal experience, it was very insightful and it was very fun. You can share this, you can promote it among your national member organization, you can promote it among your local members. For example, this is one of the domains of the game about documents. So this is a question in this card that says, there are many documents that can help guide students, healthcare professionals, community organizations and universities to drive and monitor social accountability. And it gives you options here and you have to guess. So the answer is Bolin and Heck, 1995. And Bolin is referring to Dr. Charles Bolin, which we brought to you today through this webinar. So how amazing is that? Okay, so back to the website, you can go here, you can find this other very cool thing. It's a social media campaign. For example, you want to raise awareness on a very large scale within your national organization of IFMSA in your country. So it provides you with infographics, very beautifully designed infographics that you can see over here. And you can share them on your local or national social media communication platforms and raise awareness about social accountability. Other tools that Other tools here is the student declaration. You can find it in a PDF version. The student declaration on social accountability in health professions education that was presented during the World Summit on Social Accountability in Tunisia, April 2017. It was endorsed by so many other organizations, and it was a very powerful declaration. It was a very powerful student advocacy tool at that specific time. Also, there is a three.
Sorry.
Yes, sorry, of course.
Sorry to interrupt, Abdullah, but I have to go. The reason is because I had planned for an hour and a half, and I have a guest who is waiting for me downstairs. So I have to leave you. I'm very sorry about that. I want to congratulate you. This was a wonderful meeting, well set up. And so congratulations. I want also to say that if I can be of any use in the future to help you, colleagues all over the world, medical students, please do not hesitate. I'll be available anytime. Thank you very much. À bientôt. Bye-bye.
Thank you so much, Dr. Berlin. It was a huge pleasure to have you. We're honored. And of course, we will keep in touch. We will definitely use your help in so many other future endeavors and activities of IFMSA and beyond. Thank you so much for all your support. Thank you. Okay, so back to our presentation. I just finally would like to present one final slide here. It is from a survey that we conducted in IFMSA in the period of March 2020. So basically, we have this very cool survey that we send every 6 months. It's called the NMO report, a report that is filled by national member organizations. And among the questions that were in that survey, we asked our national member organizations, have you used the IFMSA toolkit on social accountability? 41% of the national member organizations said that yes, they have used it only in that specific period, only in that specific 6 months of time. And among the 124 national member organizations that have responded, that is composed of 50 countries, 50 national member organizations in 50 countries. So that is definitely an indicator of how we have been working on social accountability, how we have been implementing and promoting social accountability within the IFMSA context. So I guess we have reached the final part, which is the questions. And sadly, Dr. Berlin is not able to answer the questions, but if you have any questions specifically for him, we will make sure to forward them. And otherwise, I think Björg is available to answer any questions that you have. Is that correct?
That's correct, sure.
Perfect, amazing. So the first question, and yes, by the way, feel free to drop your questions on YouTube as well, not only on Zoom if you are watching us through YouTube. So the first question was from Muro Rodriguez, and they're asking if there are any small actions that students can apply every day to improve their schools and social accountability, not necessarily taking big action in order to achieve change, which is something that I personally can relate to. As a student, especially as a medical student, it's not very easy to become an activist. It's not easy to become an active advocate, especially with all the workload, with all the studies, with all the mental fortitude it requires. So maybe you have experienced student examples of how can they contribute to the process in small actions in their usual day-to-day student life.
Look, I think there's important actions at every level. And I was just thinking about it. I'm happy to organize another session of sort of more brainstorming, because I think it would be important also maybe to get some other students that have successfully, been able to kind of raise things as well, because they are probably more familiar than I am with actually how easy or how hard things are. But I do think, first of all, just start, if your school isn't currently socially accountable, doesn't raise awareness of those things, the first thing is actually to get educated about it. And that may mean just do some reading about it, reach out. I'm so blown away by all your resources that you guys, we were part of the beginning, but you guys have just taken it to new heights. So impressed. So you have tons of resources to start with. But I think, the essence of social accountability is around understanding needs of the communities that you will serve as a professional. So learning about social determinants of health, listening to people, participating in community events, might be just a part, bring a few students along, try to understand, maybe, to do some activities in a community which you're not familiar with. Reach out to students that may be from some sort of minority group, or that might have a different experience, etc., etc. Build a community also of like-minded people, because it is really hard to hold on to an idealism when reality of paying for education, caring for family members, people have a lot of mixed and difficult and different burdens. So sometimes that can be a luxury to indulge in. But don't give up on the passion, because there are amazing people that are out there. Reach out, try to find mentors. And that's, because you will notice there's always going to be faculty members that have this inclination, and talk to them, ask them, older students, or other clinicians. It doesn't have to be medical doctors. It could be wherever, depending on where in the training you are, somebody at your clinical site. If there's a social worker, talk to the social worker. It's a lot to learn, and they will might be able to point you in a direction where you can not only strengthen your own competencies and understanding to be a socially accountable health professionals, but you can identify maybe small things that could change, that could be incorporated into curricula, whether it's your own project that you have to do, etc. So I think you guys have so much. Every time I participate with students, I'm just blown away. There is this Network Towards Unity for Health conference that actually there's a student organization that's very active, and they have a very strong community engagement focus. And the research project, some of them come from schools that have, like, there's a couple of universities in Sudan actually that are doing incredible work, and their medical students have gone out and done just amazing research that informs all of us. So don't underestimate what you can do by just looking in that direction, and getting support from somebody else, and sharing that experience with maybe the student in the year afterwards. So there's a lot of this. Cultural and social change is really hard. So I think it's particularly important to support each other. And we've been forced, certainly with COVID, to connect more via Zoom, which is less satisfying, but it actually is opportunities. So if you guys identify particular areas you're interested in, reach out. Maybe I can find some faculty or some students at some of our schools that are socially accountable, et cetera, et cetera. Reach out and ask, and lots of people will be very happy to help.
Those were some very strong words, Björg, and I cannot emphasize on how much I agree on the concept of mentorship. It's very necessary for all student activists, for all those aspiring to make change. And yeah, what we are doing here right now is basically a mentorship opportunity, of course, with you and with Charles. So I understand that you have a full schedule and a busy agenda, so we can either have very short answers and take all the questions, or if you would like to just stop me at any moment if you want to leave, it's totally up to you. I totally understand. Or I can send you through email. So what do you prefer?
Well, we can try to take a quick stab, because people have waited quite a long time, so that's fine. And otherwise, if there are really follow-up discussion where we can brainstorm or get the groups of people, I'm happy to organize that for another time. But happy to try to take a stab at some questions that are there.
Great, perfect. Okay, so there is a question from Rukaya Ibrahimi. She's asking about accreditation and accrediting agencies recognized by WFME, and how can those accreditation processes become based on social accountability. And a very linked question to that is from Tomasz Petras. And of course, Tomasz is our medical education development assistant, and he knows quite a lot about this domain. He's asking also about the rigid accreditation systems in some countries, that they are not specific for medical education, could be more of a higher education based for all specialties. And in that case, it is very difficult to navigate opportunities to make the processes based on social accountability basis. So what do you have to say to both Rukaya and Tomasz?
So the quote unquote good news is that now you can refer to the fact that your country is supposed to report, each of your country, I think without exception, countries are going to report back to WHO when they provide health workforce data, are supposed to report back whether their accreditation standards incorporate social accountability principles or standards. Now, there's a lot of countries that don't have accreditation systems, so that is one thing. I also know that WFME has incorporated some standards of social accountability into their standards. They tend to be the sort of, they have two levels of standards. One is sort of, the basis, minimum standard, if you will, and then, the more stronger social accountability standards are the one that the aspirational to some extent. But it is in the process. Look, this is hard to change, and like Tomasz talks about, there is a natural tendency of doing things like we've always done. But I do think, like one of our deans said, don't let a good crisis go to waste. Use COVID. COVID shows us that we're failing, and that the people that are, so there is a lot. It's a time where people and institutions are reflecting. So get involved in that dialogue. Ask the questions. Maybe we could jointly create a campaign. I know that there's this meeting. I'm a part of the planning committee that Charles mentioned around accreditation. We know this is going to be a long and slow process, but we need allies such as you guys to support that. And again, find allies. There are organizations. I think a lot of people and a lot of patient organizations, they have no clue that this is even an issue. We actually, in the beginning, had to kind of explain, well, actually, your schools are, especially in richer countries, there is just this assumption that, we're aligning all our curriculum to needs when they're not. And there's quite a bit of resistance. So it is hard. Find out who makes decisions and just have dialogue. People are often more open to students than what you would think, as long as it's not as threatening beginning conversation. And then when the time comes, push, find partners. There's but accreditation is something that's essential, and I believe that we will, this planning group will definitely reach out to IFMSA or at least I will certainly lobby for it, in terms of getting you into that dialogue, because you're a powerful voice.
Thank you so much, Björk. Thank you. And that was very efficient. By the way, I asked you 2 questions. You have answered 3, because Yusra also asked about COVID-19 and you have answered that question as well. Maybe we can take 2 more questions, something from YouTube. We have Jordana from Jamaica. Is asking about how does this looks like about government efforts and enforcing or encouraging social accountability from the government level. How does this look like in developing countries, and especially in countries with financial burdens or financial difficulties?
Look, that is actually a really important question. as I think I mentioned before, some of our greatest innovation are coming from low-income countries. Our Filipino schools, we've got, schools in Nepal, Sudan, South Africa, etc. So it's not an excuse not to do it. One of the areas that we're involved in is doing research on what works and trying to demonstrate that the fact that, because most low income countries actually pay for the education of medical students, some are private, but in a lot of them, the government at least has bursaries or some sort of support for students. So if we can demonstrate that if you train your own doctors and they are not prepared to actually meet the needs of your country, or if you're not using these social accountability approaches, they might emigrate. And what is the return on investment? So investing in these students, and we have to think holistically, because one thing is that's why it's important to advocate and policies at government level, because there's only so much you can do if you don't have adequate salaries, if you're working, or if it's unsafe, et cetera, et cetera. So we all have to be lobbying governments and explaining and telling the story why this actually makes sense to them. And that the accountability part, or the social accountability part, is actually that medical schools become more active participant in strengthening the health system. They're not just producers of little widgets, but if they foster caring, if they foster a way and provide service delivery, which all of our schools do, their students spend a lot of time in communities that have no health services. That is already providing benefits. So there's a lot of both research and sharing evidence, and a lot of it is out there. If you find it, help convince people, have your faculty become partners. Again, we're going to have to work together on this, and it's going to be different in each country and in each context. But the fact that Indonesia actually has incorporated some social accountability standards in their accreditation. So there's examples to learn from.
Great, thank you so much. I would like you to apologize to everyone, because apparently the comment sections in YouTube as well as on the chat are exploding with questions, but we are almost here for 2 hours, and we have to end this webinar, sadly. If you have any further questions, please do not hesitate to email me at lme@ifmsa.org. And I will be glad to forward any questions to either of Björg or Dr. Charles Bolin. And here I would like to thank Björg for staying with us for 2 hours, for giving us all those information, from giving us all the examples of the work. We are very proud of our collaboration and long-lasting friendship with the NET. And I would like to also thank you for being a huge supporter of students and student initiatives in medical education, healthcare education, and in social accountability. Thank you so much, Björg, CEO of the NET, for joining us today. Thank you. It was a pleasure.
It was a pleasure for me. And I'm just thinking, if there's tons of written questions I have to answer, maybe we can have another call, where we can answer the question. They're easier to do in a webinar than written, because otherwise I'll have to think too much. But really appreciate it. And again, let's continue to work together, brainstorm about how we can support each other's effort, both in country or in institutions, and move this forward. Thank you guys for having me, and all the best. And all of you, stay safe.
Absolutely, that was very generous of you. Thank you so much, Björg. And I would like to also extend my gratitude to Dr. Charles Bolin, the father of social accountability, who have worked for 25 years or probably more on social accountability, former WHO program coordinator on human resources for health, founder of the 5-Star Doctor Framework, and many more achievements. I would like to extend my thanks to him. for joining us today and for being so generous and giving his time and his very informative answers to all our questions. Thank you, everyone joining us from everywhere in the world. Thank you for joining us on Zoom. Thank you for joining us on YouTube. This will be recorded and you can find it later on the IFMSA YouTube channel. Again, if you have any questions or something that you would like to ask, please don't hesitate to contact me at lme@ifmsa.org.